Welcome to SCORE Nashville's Lunch and Learn on affordable health benefits on a lean budget. This is great. You guys have to listen in. And your instructor is Ann Wires, excuse me. And she's been the HealthPass lead at Faith Family Medical Center since it officially began in 2021. In fact, she's one of the originators, the designers of it. She's worked in healthcare for 27 years, serving at both Ascension St. Thomas and Faith Family Medical Center. So she's going to explain the program and how wonderful it is. So, Anne, the floor is yours.
Excellent, and I will share my screen. There it goes. Well, I'm delighted to be here, and I'm very appreciative of SCORE that they make this available for people to learn more, because we know it's a challenge for small businesses in particular, for health benefits, health insurance in particular. So we're so glad, I'm so glad, Michelle and I are so glad you're here today. As Michelle said, I lead HealthPass for Faith Family Medical Center. And this was begun by our board members had these ideas. And our board members at Faith Family Medical Center is comprised of quite a few very successful entrepreneurs. Of course, they started out as solopreneurs at some point. So they had this great idea, and we don't know of any other nonprofits that offer anything like HealthPass. So we're very proud of it. So I want to show you today how HealthPass could help you offer real meaningful care to your employees now, or if you're a solopreneur, it could be for you, or it could be for, once you get your more employees, how you can do that. And even think about this for if you have any contract workers or plan to, contract employees, or in the healthcare industry, we call them PRN employees, or employees needed, there as needed. Oops, there we go. So I'm going to share a little bit about Faith Family Medical Center, because that's very important to help build the trust. Unfortunately, and I read this a lot with some of the, I want to learn as much as I can about a lot of topics, healthcare included. And I often see commentary on how there's such distrust in the healthcare industry. And so part of the building of trust for HealthPass is telling you about Faith Family Medical Center. So Faith Family Medical Center is almost 25 years old. It is very important to note that we are a nonprofit. And that's going to play when you wonder, how in the world can they offer these have these offerings for such affordable prices? It's because we're a nonprofit. I'll tell you more about that later. We've been providing excellent, affordable, and convenient primary care to the working uninsured people of Middle Tennessee. And as I said, for nearly 25 years, we expanded to include underinsured when the Affordable Health Care Act came into existence, because we didn't know how that would impact Faith Family. As it turns out, didn't impact as much. But we do serve underinsured, that meaning people who have a very high deductible. But we're really there for the uninsured people who work at least 20 hours per week on average. We operate, and you can see a picture on your screen, out of a state-of-the-art facility. We moved into this facility in 2020. It's in the heart of the medical corridor, so I can see St. Thomas Midtown Hospital from, when I look that way, and I can see Centennial Hospital when I look that way. So you get the idea. We are located, centrally, but we're not downtown, which is nice. It's much easier to get to us, and we have parking that's our own. Don't have to pay for it, and it's easy to utilize. So the clinicians at Faith Family treat the whole person, body, mind, and spirit. And we base our model on our providers being able to spend a lot more time with their patients than you would normally see in a for profit primary care uh, practice. So, a new patient has 60 minutes with their primary care provider and 30 minutes for any follow up appointments that might be needed. So we offer services that you don't often find in a primary care facility, such as behavioral health. And boy, has that gained in popularity recently. Nutrition coaching, fitness, spiritual counseling, if desired, assistance with medication cost, and chronic disease management days. Now, I want to sidebar a little bit with the spiritual counseling. Sometimes when I give tours or talk to people, if they're brave enough, they might say, I see faith is in your name. There's a cross there. Am I going to be welcome if I am not a Christian? And the answer is yes, absolutely. We serve people of all faiths, no faiths, or faith. It's the people who work here are Christian. But again, we do not evangelize. We feel that the best sermon is to be a sermon. So just know if that is in your head, if that's a question, hopefully I've shared that with you, but I can always follow up and give you more examples. We believe, we believe that healthcare should be affordable, accessible, and delivered with dignity. So one way that we live out this mission at Faith Family Medical Center is through HealthPass. And quite honestly, HealthPass was created so we could get more patients through our doors, so we could serve more patients. But as a result, small businesses in particular and nonprofits, small nonprofits, are really benefiting from HealthPass. So we all know that the current health insurance system, I should say, creates real challenges for small businesses and their employees. You know this, or you probably wouldn't be on this webinar. And the truth is, and we probably know this too, the current health insurance system wasn't designed for small employers or for your teams necessarily for small employers. For employers, the cost for health insurance are often unsustainable or can't even begin it. And for employees, I'm finding, especially if they're not paid, what is very much these days, employees often can't afford health insurance that their employers offer if the employers expect their employees to bear part of that cost. So healthcare can feel really out of reach. And I'm probably preaching to the choir here. So HealthPass was designed to bridge the gap. So let's take a look at the numbers. Last year, the average employer spent $702 per month to cover a single employee with traditional health insurance. And the employee still paid on average $140 per month themselves. And these amounts, again, probably no surprise to you, have significantly increased for 2025. Now, the good news is that giving your employees access to the health care they deserve just got easier. And we're going to go over what this covers, but it's a little sneak preview, at only $20 or to $50 per participating employee per month, HealthPass is less than 10% of the cost of a traditional health insurance plan. So HealthPass is the bridge between your desire to support your team and your ability to afford it. So here's again, I'm going to go into more of this, but a little sneak peek of what is included. So it includes primary care, behavioral health visits, an annual wellness exam, a free annual flu shot, discounted diagnostic services like x-rays, MRIs, CT scans. We certainly have a network that we've created to refer our patients to when they need help beyond primary care, So a network of specialists and other hospitals and other ways that our patients are served beyond the walls of Faith Family Medical Center. We also offer discounted dental, discounted vision, discounted hearing aids, discounted durable medical equipment are some of the options. And then some of these benefits, I'm going to tell you more which ones, are even extended to spouses, domestic partners, and dependents. So for uninsured employees, this kind of care can be life-changing. And I've heard many testimonials by HealthPass members who have become patients at Faith Family of how it has changed their lives. So we've designed HealthPass with small employers in mind, as I said. The in-person care is provided at Faith Family Medical Center. The in-person care is provided at Faith Family Medical Center. We have one location, and I've already described where we are. And but we do have patients that we see out of 31 out of the 33 counties in Middle Tennessee. We have patients come from 31 of those counties. We even serve patients who drive to us from southern Kentucky or northern Alabama. So people do drive to come to us for their care. Naturally, though, Davidson County and the contiguous counties are where we see most of our patients. Now, we do have telehealth available, and that helps too with the one location. HealthPass Portable, you're going to learn more about that. We have a partnership with a company that has been in existence for decades, like we have, and they are in the business of offering health benefits. So we partner with them, and HealthPass Portable product is available throughout the United States. So we've already talked about this. We built this for small businesses, larger employers who can't offer to all of their employees the health benefits, or nonprofit organizations. And I bring that up because you might be involved with a nonprofit, and HealthPass might be a good option for them. Likewise, you may encounter people in the community who you might share Faith Family Medical Center about Faith Family Medical Center. So you're going to be official ambassadors for both by the end of this, or I hope you will. I ask you to. So we're going to talk now about the 3 plan types. I say this over and over again because it's very important that the monthly amount I'm going to share is per participating employee, meaning you do not have to pay for all of your employees to participate. Only those employees who want to participate or that you choose to offer HealthPass to. Okay? Now remember, and I don't think I've said this yet, and the attorneys would want me to say this every time I switch to another slide, but HealthPass is not health insurance. HealthPass is not health insurance. Okay, I've gotten it in at least twice now. I've worked with many businesses over the past 3 years. We have 32 who have signed on to date, and I think we're about reaching a tipping point where it's really going to take off. That's what we are anticipating. So I've witnessed, because some employers are a little bit cautious because they think that all of their employees are going to immediately sign up for HealthPass, but that's not necessarily the case. I've found the trend is that most employees do not sign up for HealthPass, not because it's not wonderful, it is wonderful, but because they have health insurance elsewhere or through a spouse or domestic partner, or they're young invincibles and they're never going to get sick. So lots of reasons, but I think that's important for you to know. And as I alluded to just a moment, it's on the slide too, you choose what you want to offer and to whom you want to offer it. So you don't have to offer it to all of your employees. You could do it based on, well, we'll go over that in another slide. That's later. Okay, so as I've been pitching this to companies, so many companies, I get this look. And for a long time I thought, what in the world is that look? And finally I was telling someone that I knew about HealthPass, and I got that look and I said, what is that look? I get that so often. And he said, Anne, this is just too good to be true. This just can't be true. I'm like, well, it is true. You know me, and those who know me know that I'm an under promiser and an over deliverer. I would not be selling, if you will, and I'm selling HealthPass if it wasn't the amazing product that it is at the affordable price it is, because I'm not a professional salesperson. I have been in health and human services work for 38 years. So I promote HealthPass because it's true. It's true. I want to serve more people and get them healthier. And that's what Faith Family wants to do. So how do we do it though? Faith Family Medical Center last year raised $2.1 million to offset the cost for our patients so that they don't have to pay what it truly cost us to provide their care. We raised $2.1 million last year. The goal is $3.1 million this year. So as employers, as patients, you all benefit from us raising that money. So that's how it's true. It's true. It's not too good to be true. All right. Let's talk about the first product. Let's see. I'm reading to see. I've already gone over that part. HealthPass Primary is $38 per participating employee per month. So the employees who participate in HealthPass Primary will have a $10 copay, which is very much lower than the sliding scale that our regular patients pay. But that's part of being part of HealthPass. $10 copay per visit, and that includes most provider-advised labs. So quite a deal. So, as I've said, but I'll say it again, we are a primary care facility. We are not urgent care. We want to be our patient's medical home. So they receive all those primary care and preventative care as a part of its services. And I said about behavioral health, I'll elaborate a little bit more. We have a full-time nurse practitioner who has trained in behavioral or mental health, and she is allowed to diagnose and prescribe medications, and she also does some counseling. And if counseling is needed beyond what she can provide, she links our patients with other counselors out in the community who have the more in-depth counseling. So that's part of the, and can you imagine coming for a behavioral health visit for $10? That's just unheard of. We have an on-site pharmacy assistance program, and it's available for patients who qualify, and most of our patients qualify. And we have students from the Lipscomb College of Pharmacy who do one of their final rotations before they become pharmacists to fill out the paperwork on our patients' behalf for the pharmaceutical companies to see if they qualify for free medications. And it's like buying a home. It's just so involved. But our patients don't have to do that. We do that for them. Last year, that resulted in, are you ready for this? Nearly $5 million worth of free medications for our patients. And we have free medications given to us by another nonprofit as well. So that's quite remarkable. HealthPass Primary also includes access to our Journey to Wellness programming, and anything that's done in our Journey to Wellness program for our patients is free, 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 free. So that would be, for example, we have a registered dietitian. Our patients can see that registered dietitian all that they want or need to, free. She also does tobacco cessation. We have other wellness counseling that's provided through Journey to Wellness. We even have cooking demonstration classes in our Journey to Wellness that are free for our patients. Disease management days for the chronic diseases of diabetes and hypertension in the Journey to Wellness for our patients. We have a yoga class. So there's quite a bit available through HealthPass, through Faith Family Medical Center, through HealthPass Primary in particular. And all of that is just for $38 per participating employee per month. The next product is HealthPass Portable. So some of your employees, or you, if this is for you as a solopreneur, solopreneur, may have access to primary care, but they don't have access to health insurance for dental or vision needs, for example. So at HealthPass Portable is $20 per participating employee per month. So you can see there what's included. And I'm going to give you some examples of where you could go for these dental and vision services. The dental network is through Aetna Dental Network. There are over 262,000 available dental practice locations nationwide. And in most instances, Portable members save 15 to 50% per visit. Specialty dental care such as orthodontics and periodontics are included. Now with vision, the savings are available at over 20,000 vision providers nationwide. Members save 10 to 60% on glasses, contacts, laser surgery, and exams. And some examples of participating chains are LensCrafters, Pearl Vision, VisionWorks, JCPenney, Target, and more. Teladoc is also available as a part of HealthPass Portable, and you probably heard about Teladoc, but that's access 24/7, 365 to a board-certified doctor anywhere you are. You would have access. It's for general medical issues, and they provide diagnosis, I can't say it, diagnosis, treatment options, and prescriptions if medically necessary. And that's typically for a $15 copay, but that is remarkable. Now it's interesting that a lot of people don't know what an employee assistance program is. So I'll share a little more for those of you who aren't familiar with that term. So employee assistance program is, as they describe it, what our partner does, to help employees cope with the ups and downs of life. So they have professional counseling and work-life support available telephonically 24/7. It's all confidential. It's a short-term counseling conducted by phone. But there are also other examples. If someone is overspending, they're in debt, they can call the telephonic employee assistance program to help with debt reduction, to develop a budget, for example. Or if someone has a parent, for example, living with them that has Alzheimer's, but it's become beyond what that person can handle, they could call the telephonic employee assistance program to get some ideas of the next step for that parent. Those are just a couple of examples. Discounted hearing aids and durable medical equipment are also available through HealthPass Portable. The third product and final product is HealthPass premium, and it's the most comprehensive. It's $50 per participating employee per month. So it includes all the care that I shared that through HealthPass Primary that's given through Faith Family Medical Center, plus what's included with HealthPass Portable, with an upgrade, if you will, on the counseling services that's included. So through that upgraded counseling services, there are 6 free sessions, and they're more in depth than the portable, by phone or by device, or even in person. So that's a little upgrade in the counseling portion, as we know that's so greatly needed by so many these days. So those are the 3 plan types. That's the history. Please, let's see if anybody has questions at this point.
I have a question.
Yes, Lisa.
And sorry I'm not on camera, but I'm trying to clarify exactly how this works. It works the same way as any other program. We pay the $38 or the 50 or whichever we choose, and then they come in and pay the additional their co-pays, the same as any other insurance. Oh, and one other question while you're working on it is there a minimum number of employees that we have to sign on?
Ooh, great questions. I really should include that. So I went on to the next slide because your question is a great question, both of them. It's so flexible, you decide. So you can decide if you want to bear all the costs for the employees. That's what most of the businesses that I have, they do that. Or if you want the employees to bear a part of the cost, you decide that. If you want to, how much, you absolutely decide that. You would collect, through their paycheck, what portion you expect them to pay, and then give us one lump check for everything. But you decide how you want to structure that. And one employee is enough. One employee is fine. Absolutely. And I realize that because we have very small employers and solopreneurs, well, let's say you have multiple employees, but you're small. And so, yes, you have one person who wants to participate, but then that person moves on to something else and you don't have anybody on the roll, that's fine. But then you hire someone and they want to participate. So it's very flexible, very, very flexible.
Thank you so much. Thank you.
You're welcome. Are there any other questions at this time?
And didn't you say that even the business owner, if they do not have any employees, can actually get one of the programs?
Absolutely. And I have a couple of solopreneurs that have done that, included themselves, and even non-solopreneurs for that matter. But yes, you could absolutely join HealthPass for yourself. Thank you, Michelle, for making sure I, included that. What other questions? I have one you might want to know. You may have, if you don't now, you may in the future have Spanish-speaking employees. And we have a large Spanish patient population because of word of mouth. We do such an amazing job that our Spanish-speaking patients tell friends, family members, and refer Faith Family to them. And then they come to us and they love us, and you know how that goes. It's wonderful. So 70% of our clinicians are Spanish speaking, and I have all of my HealthPass information translated to Spanish. So that's important for you to know, and if not for your business, as you are an ambassador now, you can share that with others. All right. Any other questions? All right.
Oh, I'm sorry. I hate to
It's
be
all right,
the
Lisa.
one.
It's all right, Lisa. I'll
Okay.
pay you later for these questions.
Well, these are things I really need to know. And this one is if a person, for example, I've had my family insurance, my primary care with my family where we are for quite a while. I really don't want to change that. But say, for instance, someone comes along and they say, "Well, I don't want to uproot from where my family is, but I want to have insurance here or supplement or whatever they do." Is that a possibility?
Well, what I would say on that is HealthPass Portable might be the better option. We really want to be people's medical home. You know that is really important, and we're not in urgent care. We so I would say in that scenario, if they and I understand, I'm loyal too. I've been with the same primary care physician for 20 years. So I would probably say no. They need if that's so important to them, which is I understand. They need to stay with their primary care physician and might consider a Health Pass Portable. Yep.
Okay. Thank you.
You're welcome. Keep them coming. You know what? And I'm glad I said Health Pass Portable. I don't think I said this. I don't think so. Health Pass Portable is available at no additional charge to the spouse, the domestic partner, or dependents of that Health Pass Portable member at no additional charge. Okay? That's pretty amazing. Health Pass Portable. Health Pass Primary, that's not the case. But once someone becomes a Faith Family Medical Center patient, then their family members can come to us. Now, they would pay on the sliding scale unless they want to be part of Health Pass as well. But that's pretty wow. That's wow. Okay, let's see here. We already talked about employees can pay a portion. I think I've pretty much said let your employees decide. I mean, if you offer all three products, for example, you can let them decide which one fits them. Or you could only offer one of the products. I have companies that do that. You decide. And then I think I've already said this. You can tier the offerings, what you offer, based on length of service. Maybe it's a carrot to get people to stay longer, and they have to stay at least 3 months, for example, or just based on hours. Certainly, you decide. Let's see. Any more questions, Lisa? Okay, Michelle. All right. Well, it has been such an interesting and wonderful journey, this Health Pass, and I'm an entrepreneur of sorts with Health Pass, and so I've lived in the entrepreneur world a little bit, but I do have a safety net, and because I don't think I can do it without a safety net, but has been such a good experience to be a part of Health Pass and seeing how it's changing the employees' lives, but certainly the employers' lives. I'm going to share just a few examples. I wrote them down from memory, just a few of who we have, and I'm sure any of these would be uh, wouldn't mind to give referral at all. Vega Designs, it's so cool. They customize automobiles or vans or whatever it may be, vehicles, just to outside, inside, amazing. Vega Designs is one of our Health Pass partners. Old South Landscaping, Compost Nashville Foodscapes, Nikki's Coal Fired Restaurant, Southern Domestic Diva, who's a housekeeping services, both residential and commercial. I've had 9 child care and child development centers that are part of Health Pass, and many others. And amazing, I think this tells the tale too. We've retained all of those business partners except for ones who have either moved to California, and they were HealthPass primary, so they moved, and I love this, we don't mind being stepping stones, or they were able to begin offering health insurance to their employees. Don't mind that a bit. Let us be your stepping stone. Those are, or the business owner just couldn't afford it, but she wants to come back when she can. So we retain the businesses and nonprofits who are part of HealthPass, and I think that obviously tells the tale. So let's see. Yep, I went through that. All right. If you would like to discuss HealthPass further, the first step, of course, is to contact me, and then we can talk further. Under promiser, over deliverer. And I often have employers that have an employee or for themselves, they needed to discuss their particular medical needs to see if it's a fit. Happy to do that. I go down to the clinic and I describe the situation, and they determine if they think it's the best fit or not, in their opinion, which is really good. So let's see. Here is my contact information. Let us bring hope and healing to your team. And I love to give tours, always available to give tours if you'd like to come by. My pleasure, at your convenience. We also have an area in the Journey to Wellness where people can use our space free of charge to host a meeting. So we can talk more about that. So do call if you're interested, want to know more information. And I want to thank SCORE. SCORE is amazing. I've known about SCORE for decades now, and I'm so grateful that SCORE is allowing HealthPass to be shared with all the people associated with SCORE. Thank you so much. And spread the word, please.
Great. And thank you so much for the information. And I hope you realize you are the only presenter that is allowed to market their product or service. We just think that HealthPass is such an incredible benefit for, budding entrepreneurs. I know I couldn't afford medical insurance. And sometimes people stay in their job just to be able to continue to pay their health insurance rather than being able to go full-time in their business. So it's a huge, huge benefit. Thank you. For those of you on the call, I appreciate you being here. Please go to the SCORE website, score.org/Nashville. Click on Take a Workshop and see we have an amazing lineup over the next couple of months of lunch and learns. We have on Saturday the 2nd, we have a small business, big impact, generative AI. So if you're interested in learning about ChatGPT and the other services, that's where you need to be. So we appreciate y'all being here, and we look forward to seeing you in the future. Thanks, Ann.
Thank you. And Lisa said she'd like a tour. So Lisa, you have my information. I'll leave it to you to reach out to me and we'll schedule it. Thank you, Michelle. Oh, thank you.
Take care. Bye-bye, y'all.
Bye-bye.